Hi, my name is Dr. John Erickson. I want to thank you for joining me today. Today I want to talk to you about fibromyalgia and chronic fatigue. You or someone you know and love has found us here on the internet and are watching this video because you're suffering from the debilitating symptoms known as chronic fatigue syndrome and/or fibromyalgia. Now, there's going to be some important decisions that you're going to need to make here shortly, so I encourage you to sit down with a loved one and watch this short video clip and take advantage of the offer at the end of this video. Fibromyalgia is a condition that affects mainly women. It has many debilitating symptoms such as poor memory, extreme fatigue, brain fog, difficulty concentrating and staying focused, difficulty staying engaged in doing the things that you enjoy. It involves pain, many times pain that may travel from one area of the body to another depending on the day. It involves feeling depressed, feeling anxious, feeling like you're losing hope and losing control of your life. Most people who have been given a diagnosis of fibromyalgia or chronic fatigue have been to many other doctors. They have actually had testing done. They've had many people looking at their situation, and as a way of ruling things out, after all of the other tests seem to come back negative, they're given a diagnosis of fibromyalgia or chronic fatigue. Along with that, though, is also the understanding that the doctors could not find anything wrong with you. So perhaps it may be in your head. If you are like most of the patients that I consult with, the problem is not in your head. There truly is something that is not right. And simply because nobody else has been able to find it up to this point doesn't mean it's in your head. Doesn't mean that you're unfixable. The situation I find with most of the patients I consult with goes like this. They've been to many doctors. They're tired of going to many doctors. They get one of two different types of responses. One response may be that, yes, we can help you. Here's a new drug. Here's a new vitamin. Here's a new procedure. Here's a new therapy. Only to find out that after much time and effort, it didn't work. You're still in the same place that you were before, and you may even be worse from some of the symptoms or side effects that you're dealing with from procedures that were not geared towards addressing you as an individual. On the other hand, some people are told, quite frankly, there's nothing that can be done about it. It is in your head, or you are at that age, and so you just need to learn to live with these problems. You see, by the time most people get to my office, they are tired, they're frustrated, they're depressed, they're actually losing hope that there may be anything that can be done for them, yet they still are looking, and that tells me there still is some sliver of hope that they're trying to cling to find some answers to help them overcome their current situation. Now, I want to make one thing very clear to you in the beginning. I am not a medical doctor. I do not dispense drugs. I'm an alternative care doctor. I'm a chiropractor by base training, but I have extensive education in the area of neurology and metabolics, how the body works, lab testing and interpretation, how to use and identify areas of the energy systems of the body that aren't working appropriately, diet and lifestyle, nutrition, etc. You see, I take a very comprehensive and all-inclusive approach to the patients who come into my office. And my unique approach, my goal with everyone that comes into my clinic, regardless of what their situation is to help them identify what is the problem behind the symptoms that they're dealing with. And up until this point, to be quite frankly with you, many people have not had this type of care. They have simply had what we would call symptom relief care. You have an ache, here's a painkiller. You're not sleeping well? Let's give you a drug to help you sleep well. These are not treating the cause of the problem. And it is because of the unique approach that I take by identifying what is truly going on with your body, we can help people with many chronic illnesses to begin to experience more energy, improved quality of life, reduction or absence of symptoms. Because what is going on with you up to this point is exactly what I have just described. You have been to other doctors, other healthcare providers. They have simply been trying to cover up or address tiny parts of the equation or the problem that you're dealing with. They have not addressed the main issues to the degree that we can actually tip the scales of health in your direction. In my office, I help my patients do that through our very comprehensive evaluation, through our testing and interpretation, through our education and coaching. We can actually help you tip the scales in your favor. You can begin to experience increase of health, increased energy, better sleep, more focus, better memory. All of the things that you're experiencing negatively with fibromyalgia diagnoses, we most likely can help you by identifying what is behind the symptomatology. We don't chase symptoms down. I don't treat diagnoses. I treat people. And that, my friend, is what makes all of the difference. I want you to know why I'm different. I want you to know what's truly behind a fibromyalgia problem. And for many of you, when I share this point with you, you will be surprised. And you'll be surprised because you'll realize almost immediately that all of the other stuff you've been doing in the past has not been working on the cause. It's been working on the symptom. I want you to know that there is still hope. But now it comes down to decision time. You have to take the step. You have to move forward. You have to fill out the information at the bottom of this web page so that you can take advantage of 2 free visits to come in and visit with me. The opportunity of that, no obligations, no risk involved, is simply for me to see if I can help you with your problem. And once that's determined, we can begin to discuss the details of how we're going to help you get your life back again. Now, if you have other people who are depending upon you, children, or a husband, or a wife, you owe it to them as well as yourself to find out what you can do to get your life back. My name is Dr. John Erickson. I want to thank you for watching this short video. I look forward to seeing you in my office. Don't put this off. You're running out of time. Have a good day.